Livy. I'll be your nurse today. I'm going to close the curtain for privacy, perform hand hygiene. I'm going to raise the bed to a more comfortable working height. Can I just check your name tag? Can you tell me your name and date of birth?
Sophia Figueroa, September 27th, 2003.
Perfect. So today I'm going to be doing a head-to-toe assessment. To get started, I am going to check your mental status. If you can just tell me your name and date of birth again.
Sophia Figueroa, September 27th, 2003.
Okay, and can you tell me where you are?
Cat's house.
Can you tell me why you're here?
Head-to-toe assessment.
Okay, and can you tell me the month and year?
November 2023.
Okay, perfect. The patient is alert, awake, and oriented ×4. And while I was assessing the patient, I noticed that she is clean, there's no body odor, and the patient just appears to be in an overall clean status. So I'm also going to check your head. The patient's head appears to be clean and washed, well groomed. It appears to be round with no masses noted. The patient's skin color is appropriate for her ethnicity, as well as her lip color. So I'm going to go ahead and check your ears and your nose for any fluid. Okay, while I'm here, I'm going to check for JVD, so if you'll just put your head at a 30-degree angle and look to the side. Okay, and the other side. Perfect. So there is no JVD noted, and there is no fluid in her nose and ears. Now I'm going to check for the color of your eyes. So her sclera appears to be white, and I'm just going to pull it down. Conjunctiva is also pink, which is perfect. Now I am going to measure your pupils. The patient's pupils appear to be at a 4. I'm just going to shine a light in them. Okay, the patient's pupils constricted to a 2 when I shine the light in them. Now I'm just going to have you follow my pen. Okay, the patient, Perla was noted, and the patient's pupils were round, reactive to light, and equal, and they were also reactive to accommodation. Now I'm going to just feel your arms and your legs. Okay, and I'm gonna check for skin turgor on your arm. Okay, no, tinting noted. Now I'm going to check your capillary refill. Okay, and her fingers and her toes. Okay, her capillary refill is less than 2 seconds in both her upper and lower extremities. Now I'm going to check your pulses. I'm going to do your carotid pulse, 2+ bilaterally, regular rate and rhythm. Now I'm going to do your brachial pulse, 2+ bilaterally, regular rate and rhythm. I'm going to do radial pulse, 2+ bilaterally, regular rate and rhythm. I'm going to do your posterior tibialis. Okay, 2+ bilaterally, regular rate and rhythm, and your dorsalis pedis. 2+ bilaterally, regular rate and rhythm. Okay, now I am going to check for any edema in your legs. Okay, there's no edema noted. I'm going to test for your muscle strength now. If you'll just squeeze my fingers, push up and push down and push up and push down. Okay, her muscle strength is 5+ in both her upper and lower extremities, which is perfect. Now I am going to check your elbows and your heels. I'm gonna check the skin. Okay. Okay, and check your heels. Okay, and while I'm here, I'm just gonna check your back and your coccyx. Okay, her skin appears to be normal for her ethnicity, no drying or cracking noted. Now I am going to begin my auscultation. Okay, so I'm going to start in your aortic valve. Right sternal border, second intercostal space. Regular rate and rhythm. Pulmonic valve, second intercostal space. Left sternal border. Regular rate and rhythm. Herb's point, third intercostal space, left sternal border. Regular rate and rhythm. Tricuspid valve, fourth intercostal space, left sternal border. Regular rate and rhythm. Mitral valve, midclavicular line, fifth intercostal space. Regular rate and rhythm. While I'm here, I'm going to go ahead and take your pulse for a minute. Okay, your heart rate was 76, which is perfectly normal. Now I'm going to listen to your breath sounds. I'm going to do 5 in the front and 9 in the back. Just breathe normally. Okay, the patient has clear breath sounds in anteriorly. Now, before I move on to posteriorly, I'm just gonna test for cannot think of the word, equal lung expansion. So go ahead and take a deep breath. Okay, and then I'll do the back. Deep breath. Okay, her lung expanded symmetrically, both posteriorly and anteriorly. Now I'm going to do the back auscultation. And wait, before I move on to the back auscultation, I will say that her heart sounds are I can hear her S1 better at the base of the heart and S2 better at the apex of the heart. Okay, now I'm moving on to posterior breath sounds. Again, you can just breathe normally, okay? Okay, her breath sounds were clear posteriorly as well, which is perfect. So now I'm going to just take your pulse for 1 minute, okay? Okay, her respiratory rate is 13, which is perfectly normal. Now I'm just gonna go ahead and have you lay down for me. Okay, so the patient's contour of her abdomen appears to be flat. So now I'm just going to listen to your bowel sounds. Start in the right lower quadrant. Okay, the patient's bowel sounds are normal active, which is perfect. Now I am going to palpate your stomach in a zigzag pattern. Okay, did that hurt at all? Okay, no masses or tenderness noted. You can sit back up. I am going to go ahead and give you your call light. I'm going to lower the bed back to a more comfortable height and making sure you have your non-skid socks on. I am going to perform hand hygiene. I'm going to raise the bed rails and lock the wheels, then perform hand hygiene. Is there anything else I can help you with? Okay, thank you so much.